Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Yes, indeed. This is Jerry Hickey, nutritional pharmacist, the chief scientific officer over here at Invite Health. And when it comes to nutrition, there's a whole bundle of us. There's a whole department of us that help people with their nutrition. So we're going to do an episode now on a nutrient we make in our body called Sammy. That's the abbreviation. We'll go into it in a minute. And when you take a little bit extra, it could be very useful for joint pain. There's some indication it's good for fibromyalgia, a type of muscle pain, for liver health in certain conditions, but especially for depression. So today's episode, we're going to be discussing Sammy for depression. Now, the reason I bring up that we have a scientific department, I'm going to give you an email address. If you have any question about anything I say on any of these episodes, you can send an email to this address, and there's 5 nutritionists attached to it, so you get a quick reply. nutrition@invitehealth.com. I'll repeat that, nutrition@invitehealth.com. So any question about nutrition, your diet, exercise, etc., these people are capable of helping you. Highly educated, wonderful people, no pressure. You can contact them as often as you like, as little or as often. So Sammy is the abbreviation for S-Adenomethionine. It's something we make naturally in the human body. The highest concentrations are in our liver where we make it, but also in our brain. And it's surprisingly useful for joint pain, and it's very safe. See, some of the patients with arthritic knees, the drugs have too many side effects for them. They don't do well on the drugs, so they're looking for options, and Sammy is a valid option. So it's difficult to truly nail down what is the mechanism of action for Sammy in the knee joint. What is it doing? It seems to be a number of good things. So I looked at critical reviews in food science and nutrition, and they said that Sammy helps to regenerate joint cartilage, and it reduces inflammation, likely by an antioxidant effect. This is from the Sciences University of Alberta up in Canada. So it's useful in the joint for a number of reasons. So then I went into the Procedures in Clinical Practice, 3rd edition. That's a book. And they're looking at pain procedures in clinical practice, for orthopedic doctors and rheumatologists, etc., practicing MDs and nurse practitioners. And they said Sammy works as well as celecoxib at the 2-month point for arthritis in the knee. I mean, that's pretty amazing. Celecoxib is the most commonly used drug in the planet for arthritic knees. The trade name would be Celebrex. And they came to various points of why it's helping. It likely has an anti-inflammatory effect because they see that it reduces inflammatory chemicals within the knee, such as tumor necrosis factor alpha, things that cause damage to the knee, things that damage the cartilage in the knee, that inflame the knee, that cause swelling, that degrade joint tissue. And that the Sammy stimulates proteoglycan synthesis. Now that's really important. You've heard of a joint supplement called chondroitin sulfate. That's a proteoglycan. It gets inserted into the joint cartilage and helps maintain the joint cartilage. So let me explain what the cartilage is in the first place. At the end of your bones in the joint, there's this slippery stuff. It's like an ice skating rink that was just fixed up by a Zamboni machine. And it prevents the bones from knocking together, so it absorbs shock. And it prevents friction. It's so slippery it prevents friction. If there was no cartilage on the end of the bones would have a lot of friction and they would break down, and you'd have actually little shards of bone in there. It'd feel like you had pieces of glass in your knee. In fact, that's what happens with severe osteoarthritis. Osteoarthritis is the number one form of arthritis. Some people call it wear and tear arthritis. It's the typical arthritis you get in one or both knees, or you get in your hips. And by far, that's the most common arthritis. And the thing is that when it's very severe, it's called bone on bone. There's no cartilage left, and the bones literally are damaged. The actual end of the bones is not just the joint itself, but the end of the bone is damaged. So they found that it likely improves the formation of chondroitin sulfate, which helps maintain the joint cartilage. And also it seems to make dermatan sulfate, which is more important for ligaments and tendons. It also has an analgesic effect. In other words, somehow it's reducing pain directly. And it's an antioxidant. It increases antioxidant levels, which is something important. It increases the level of the mother of all antioxidants. My friend Dr. Alan Pressman wrote a book, The GSH Phenomenon, and glutathione. It's an antioxidant. He called it the mother of all antioxidants, which it kind of is. And that would reduce inflammation around the joint also. And the thing is, it's really safe. So regardless what it's doing in the joint, it's not hurting you. The problem with the drugs with the joint is that they can raise your blood pressure, they can make your legs swell, they can trigger a stroke or a heart attack, they can also trigger heart failure. So that's an issue. I mean, that would be a serious issue. So it's not like you can use the drugs willy-nilly like they're candy and stay on them forever. You have to be cautious with them. So there's the Agency for Healthcare Research and Quality. It's part of the United States Department of Health and Human Services. So I went on their website. And it's their goal to develop scientific information for other agencies, for governmental organizations, etc. This is to base their clinical guidelines on. So they reviewed the research on Sammy for joint health. They did a meta-analysis of 10 human clinical trials. And they found out it really worked. Now, a meta-analysis, if it's done without prejudice and bias, if it's done intelligently, and it uses good data, it gets together a bunch of studies looking at the same outcome. In this case, does Sammy help arthritic knees? The answer was yes. 10 human clinical trials. 10 human clinical trials. Even compared to NSAIDs, Sammy worked as well as NSAIDs. It was comparable activity to NSAIDs. NSAIDs are drugs commonly prescribed for arthritis. NSAIDs include drugs like celecoxib, which is Celebrex, indomethacin, which is a prescription drug, Indocin. There's just a whole bunch of them. Diclofenac, which is Voltaren. What's more common? Motrin, ibuprofen. Ibuprofen is also Advil or Nuprin. And another one would be Aleve. So, according to this report by the government, looking at 10 human clinical trials, Sammy's very safe, it's effective, it helps with pain, it helps with function of the knee and mobility, and it helps with stiffness. And it's really safe. So let's look at some of the studies. This is comparing Sammy to the drug nabumetone. Now, nabumetone is a commonly prescribed drug worldwide. It's called Relafin. It's a prescription drug. This is the journal Clinical Therapeutics. It's from the Department of Internal Medicine, Seoul National University Hospital. That would be in Seoul, Korea. And it's an 8-week double-blind, placebo-controlled human clinical trial. 134 patients with arthritis in their knee. And they gave them either Sammy or the prescription drug. It's a very powerful drug for arthritis pain over a 2-month period. Both of them, both the Sammy or the drug, reduced pain basically to the same degree. There was really no difference between them, except that Sammy, of course, was safer than the drug because it doesn't have the cardiovascular negative effects. They both were great for pain. They both improved function, like you could bend your knee further without any pain. That's called range of motion. Or you could walk further on a treadmill without pain. And they both reduced stiffness. So Sammy was a winner. Sammy was a winner. So here's a second study comparing Sammy to a drug. This time it's to the drug Feldene, which is called piroxicam. It's in the American Journal of Medicine. It's the Department of Rheumatology, the French hospital in Buenos Aires. It's a double-blind, randomized, 3-month-long clinical trial of comparing Sammy to this very powerful prescription drug in patients with arthritic knees. 84-day trial. So it's basically 3 months. So they gave them either piroxicam, which is Feldene, or they gave them Sammy in patients with arthritic knees. Both of them relieved pain to the same degree. Sammy was as effective as the prescription drug for pain, for stiffness, for walking, for function, except it was safer. So that's the second study comparing Sammy to a prescription drug. Here's the third study. It's the International Journal of Clinical Pharmacology Research, so that's a pharmacy journal. And once again, it's double-blind, multi-center, randomized, placebo-controlled human clinical trial. It's people with arthritis in either their hip or their knee. And they're comparing Sammy to ibuprofen. So ibuprofen could be the drug Advil or Nuprin or Motrin. So it's 150 patients with arthritis in either the hip or the knee. Sammy was superior to ibuprofen. It worked better for pain, for stiffness, and for restoring function of the knee. So there we go. I mean, Sammy really works. Typically, you take anywhere from 800 milligrams to 1,200 milligrams a day in divided doses. You want enteric-coated Sammy. Enteric-coated means it has an extra coating because stomach acids can deactivate Sammy. So you want to get enteric-coated. So here's the last one I'm going to read you. This is BMC Musculoskeletal Disorders, a great journal, and they're comparing Sammy to celecoxib, which is Celebrex. It's a double-blind, placebo-controlled, randomized crossover trial. It's from the University of California, Irvine. It's a 16-week study, 61 adults with arthritis in their knee. And they found that Sammy worked as well as the leading drug, the most often prescribed drug for arthritis. In the first month, celecoxib worked better. But by the second month, Sammy was as effective. The beauty of it is, Sammy's really safe. If you get the insert from any of these drugs, you will see a black box warning from the American FDA, the Food and Drug Administration. A black box warning means it's the highest level of caution with a drug. It's the highest level of alert about a drug. Serious consequences. And in these black box warnings for drugs like celecoxib and indomethacin and ibuprofen, etc., you'll see a warning about high blood pressure, swelling of the legs, we call that edema, stroke and heart attack, and even heart failure by consistently using these drugs. So in these studies, 4 different prescription drugs. Sammy worked as well as them. The exception was with Celebrex, with celecoxib, it took time for Sammy to catch up to it. So use the Celebrex for the first month, but take Sammy at the same time. By the second month, you could get off the Celebrex, because then you're not going to have the swelling, the high blood pressure, the problems with the heart, because Sammy's really safe. In fact, it seems to be really good for the brain and the body in general as an antioxidant. So the take-home here is there are natural things that are pretty darn safe that work very well for arthritic joints. It depends on the kind of arthritis. There's inflammatory arthritis like rheumatoid arthritis or lupus arthritis. You wouldn't use the same supplements for those arthritis conditions as you would for osteoarthritis. But in osteoarthritis, if you get a good quality glucosamine chondroitin, or if you get a very well-absorbed turmeric, or boswellia, or Sammy, they do give joint relief. They do give pain relief, and they're very safe. And there's a lot of research to back that up. So thank you for tuning into the Invite Health podcast. You could find all of our episodes for free wherever you listen to podcasts, or by visiting invitehealth.com/podcast. Please make sure you subscribe. Please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. Hope to see you next time on another episode of the Invite Health podcast, and thank you so much for listening.